So MRI versus CT. An MRI is done by placing the patient in a giant magnet. And as you know, most of our bodies are composed of water. So when a water is placed in a magnetic field, the water, because of the oxygen and the two hydrogen atoms there, it tends to form kind of a dipole or charged particle. And that results in different responsivities into a magnetic field. So areas of the body that has more fluids, such as cerebrospinal fluid, tend to have different characteristics. And one of the things you tend to see, for example, on T2 weighted images, which is a specific type of image in MRI, is that water lights up. The mnemonic we learned in medical school is T2H2O. So anything with fluid in it tends to light up. Fat, for example, also responds differently. So looking at soft tissues, looking at the brain, the nerves, the spinal cord, MRI is very effective. It's also very effective for visualizing tumors and things like that. A CT, by characteristic, in contrast, is a result of a radiation field. So basically, what a CT is, it's a machine which takes multiple small X-rays and superimposes them into a three-dimensional object, for example, a body. So an a CT is very good for bony definition. For example, when I'm doing revision surgery, I oftentimes will get a CT because it tells me how much of the bone was taken out previously. When I'm trying to evaluate things like screws and cages, a CT a lot of times will look for will tell me subtle things within the bone itself that'll help me in my surgical planning. There's a study called a CT myelogram where you inject a little bit of dye into a CT scan, and that also gives you a very good idea of the neural anatomy and also at the same time the bony anatomy. So in complicated cases, for example, when patients do have multiple prior surgery with the scar tissue, a myelogram can be very useful in terms of diagnosing things that can be missed on MRI. So both modalities have their pros and cons. Both are very useful from a diagnostic purpose, and it's something that we both use all the time.